Kia ora koutou everyone, and I start by acknowledging the traditional owners of this land, the Gimoy lands. My respect and humble thanks to you for hosting us here in this amazing place. And I've been told we have a tradition in my culture, Maori, from Aotearoa, New Zealand, that at the end of our speech we actually sing, and I was put in my proper place by our next speaker, Guta, who asked me to make sure that I also honoured that when I came here, so we will do that. I will make time for it. Kia ora everyone, so we start the morning, and I hope that like me you had a fantastic time last night, and I'm going to give you the main messages first up while you're still all awake and with us. But I do agree, Frank, it's a hard act to follow those cute little kids. And there's some real future stars there, aren't there? There's some that quite like the limelight, I suspect. So my speech today sounds really dull and boring, which is on integrated services and why the need for it. And also, I'm going to propose a revolutionary idea. And that is that not only do we have to fundamentally transform what we're doing to actually genuinely join up services, but actually that there is a very real opportunity and possibility that Indigenous peoples here, Aboriginal and Torres Strait Islanders, and the approach that you take actually could lead the way in doing that. So that's the revolutionary idea. And that there is really what we're talking about is a fundamental transformation of how we work and what we do. In saying that, it's not an easy thing. As you probably know, there's a lot of international literature, and this is a growing field of interest, integrated services. But it is really about developing a systemic approach. And actually, and I'm going to talk a little bit about our experience in New Zealand, in Aotearoa, New Zealand, but actually it requires a step up by ourselves too as Indigenous communities. So I am acknowledging in saying this, that actually the only way that's really going to make a difference in working with Aboriginal and Torres Strait Islander communities, just as it is with Māori communities, is to have Indigenous leadership. That's governance, management, professionals, community workers, elders, all basically working towards that goal, because they have the greatest stake in turning things around for our children and young people. But it is going to be a challenge. It is going to be a challenge because actually that doesn't just mean doing the same thing that we've done. It does mean that we have to, as I've said, develop a more systemic approach. It does mean that we will have to learn some new tools. It does mean that we have to make an investment in workforce development. And that is something that basically will shift us from where we currently are. So I'm going to talk more about that in the context of a thing which in Te Ao Māori we're calling whānau ora, which is really placing families at the centre of service delivery and recognising something that we recognised long ago when we went through significant child welfare reforms in New Zealand in the 1980s. And that is this idea that actually you have to return decision-making to families because children grow up in families. They don't grow up in residences and institutions. That's not where they socialise, that's not where their identity comes from. It's in the context of families. Having said that, I'm not ignorant of the need for protective environments that provide short-term respite or provide some opportunity for people to get their act together. So, long story short, two main messages in there, so in case you go to sleep, please don't snore. But the two main messages are that actually we're faced with a very real opportunity and a need, and I'm going to provide some of the evidence about why this case is being made, particularly in New Zealand at the moment, and I believe looking at what's happening in Australia, also here and in Canada. A need to truly join up services. So there is a need actually to integrate what we do. It will require a step change in what we do, and I'll talk a little bit about that. But secondly, and importantly, that can only truly be led actually by Indigenous communities themselves. Not just in the interests of Indigenous children, but actually potentially in the interests of all. Because understanding how these come together and the values that we can offer everybody, I think, is actually a healthy and positive contribution that we make to these services. So, I'm also going to touch a little bit on hopefully what was covered yesterday, and I'm very mindful that Marta did a brilliant job of setting the international framework for human rights and children's rights and why that matters, and the context, the current context for Indigenous rights internationally. So we're very fortunate to have had that, and also that Cindy showed us the importance actually of, if you like, creating an effective children's movement and a citizens' movement coming around the side of governments where governments actually act against the interest, really, of its children, and especially its Indigenous children. So we've had two excellent presentations already, which tell us that human rights and children's rights should be at the centre of what we do. And that is actually a real challenge for us to try and grapple with what this might mean, particularly for us as Indigenous communities. And that really is another main message, is that actually putting children at the centre is hugely important for getting genuine change in what we do. And what is clear to me is that countries like Australia, like New Zealand, like Canada, can do far more to invest in our children and young people. We must always keep our eye on the goal, which is actually the reduction of inequality and the achievement and fulfillment of equality for all of us. Now, this framework, which looks very complicated, I'm sorry for those of you who turn off at the sign of graphs. I quite like graphs myself. I like pictures. This is actually a very simple idea, and one that I find resonates actually with Indigenous populations. Because really what it's saying is that there are a whole heap of contributions to this thing, which is really about how we develop and grow and achieve health across our life. And it's this idea that what happens in pregnancy, what happens in prenatal and early childhood development, in middle childhood and adolescence, has lifelong effects. So it has real opportunity to provide, if you like, the resilience among our children and young people as we go forward. Now, there is actually an emerging body of literature which is very strong, particularly in health, not so strong in terms of Indigenous children and their health and development, but we're going to try and fix that, but very strong in terms of understanding this impact, this life course impact, and how these early experiences really shape children's outcomes. And that's really what this is saying, that there's a whole heap of different settings within which this happens. This can happen in our school, it can happen in our local community centres, it can happen in our neighbourhood where we live, it can happen in our religious institutions if that's where we are. But actually it sits within a broader context of what's going on in terms of social, economic, cultural determinants of health. And again, this is a really important idea, how all of these interact, actually create the opportunities that we want to see for children and young people. The kind of policies and programs that we adopt, the inherent capacities that we have, both as Indigenous peoples ourselves, but also within our communities and within our society. Those foundations for health and the way in which these interact with and shape the biological mechanisms that actually lead to good health outcomes. So this, if you like, is one model. It's by Mystery and a whole host of other people, and it is, if you like, a pretty comprehensive model. It's used for health promotion, and I come from a background that includes public health. And basically it's about how we intervene, how we create this environment that allows the best opportunity, particularly for our Indigenous children and young people, to occur. One thing that I want to challenge us about, and I'm sure that every single one of you in the room, I would have no hesitation in saying that you recognise this and no doubt work on this tirelessly, and that is that In my view, there is no cultural mandate for violence against children in our communities. There is none. In particular, the taboo against things like incest and sexual violence against children is pretty universal, and there's a reason for that. It disrupts family relationships, and it has biological consequences that are negative. So we know that that's the case, and that includes, of course, the witnessing of violence, that includes the exposure to harms such as substance abuse. Now, having said that, one of the fundamental ideas that I'll come to when I talk about whānau ora and the integrated approach that I'm proposing based upon Te Ao Māori or Māori worldviews is actually this idea about not being in the blame game. We've had enough blaming going on. We don't want to continue that cycle. We're in the supporting, enhancing game. We're in the recognising resiliency and strengths game. We're in the saying, hey, you know what, as Aboriginal and Torres Strait Islander communities, you've survived some of the most hostile environments in the world for tens of thousands of years, and you've thrived. And what's more, your children have thrived. And we can learn a lot from that. So we don't want to keep pointing the finger. We want to pull on the things that actually make us strong, that actually give us our sense of confidence in our knowledge and who we are. And no doubt, Guta, when you come up, you will talk about the language, the culture, and the ways in which that strong identity provide a basis and a foundation for actually moving forward with our children. Having said that, I'm sure that many of you also know the case to be made about why things need to change. And this is not a criticism. Again, it's not about blaming. It's not a criticism of the best efforts of people who work in government statutory agencies. It's not about blaming individual professionals. It's about recognising that we have a big problem here. The problem is the huge disparities and the negative outcomes that Indigenous children experience within our countries. In New Zealand, I refer to Māori and also Pacifica children. This graph, again, please don't be turned off by graphs because they can be really fun things, says a lot in one picture. It's about bronchiectasis, which is one of the major causes for hospital admission for New Zealand children. And what it tells you is a very important part of what's going on in New Zealand society. So the Māori rate for bronchiectasis among our children, that should be 2000, to 2009, shows a pattern of increasing hospital admissions for children. So here we are here, an increasing rate for Māori. Now we look at the comparison for non-Māori, and what we see is a very interesting pattern because, fortunately, that rate has either been stable or declining slightly. That is the pattern we want for all our children. And what does this tell us? Well, it tells us of this huge disparity that exists, and it also tells us that over this period, in fact, that disparity has actually been increasing for one of the major leading causes of hospitalisation for children. So we have our work cut out for us because despite people's best efforts, actually, it's not working well enough. Interestingly, when New Zealand was settled, there was a common belief that we would all assimilate, something that I'm sure Aboriginal and Torres Strait Islander communities identify with. We would become New Zealanders with no creed and colour. We would all be one people. Now, I love this because actually this is based on the Statistics New Zealand evidence that shows that actually, funnily enough, more and more people are actually identifying as Māori. Far from dying out, we're actually surviving and growing as a population. Now, there are reasons for this which we share in common with you, our Aboriginal and Torres Strait Islander sisters and brothers. We have slightly higher rates of fertility. We have more children, and we have them at a slightly younger age. And before we get too carried away with that, because I know that there's a whole lot of judgment goes on around having children younger, and there is a lot of good thinking around delaying children until you get a little bit older, and until you get some jobs and you're in a stable relationship and you've got things sorted out. And if only life were like that. But the truth is that we are having children, actually, interestingly, and I can only speak confidently about what's happening for Māori in this regard, at the same age, if not slightly older than we were having them in the 50s, 60s, 70s and 80s. It's just that the rest of the population is actually having theirs much later, so it looks like ours are actually very young. Despite that, what we do know is that when people have their children much younger, women have their children much younger, they do need a great deal more support. And the challenge, I think, is to make sure that actually we have those supports in place. As much as we can, obviously, the community and family supports. It's a big ask when you've got a lot of grandchildren. I heard somebody yesterday's got 9 grandchildren, and you look pretty young to me. There's a lot of aunties who basically have a lot of calls on their resources, who have a lot of mattresses in their homes, as I understand it. And that's true also for us, a lot of the same people who basically have to provide support to families. But really, this is about more than that. This is about recognising that actually having those children is an investment by the whole of Australian society, and in our case, New Zealand society. That actually it's one of the best investments that we could possibly make. And I'm very struck, as I will show later here, in this, which is a common pattern, as I said, in Australia, Canada and New Zealand, because this population age pyramid shows us something which is a phenomenon of ageing that is occurring within our dominant societies. So we have this phenomenon where, in fact, an increasing proportion of the pool of children within our societies are actually going to be Indigenous, or in our case, brown children. And this is really, really important. Because actually, as the population ages, we're getting up here from young birth up to an older population, male and female. That's what this talks about. As the population ages, and Australia, you're a little bit ahead of us in this, so you've got a faster aging population than us. Actually, they're going to become more and more reliant on this pool of children. And I was very struck by a presentation by Professor Natalie Jackson from Waikato University, which I heard a couple of years ago, where she pointed out that for the first time in human history, actually within the next 20 years, we will have a phenomenon which we've never experienced before, and that is where the elderly, the 65 pluses, overtake those in the under 15 age group. The first time ever in human history we will have that phenomenon. Anyway, it's a long-winded way of saying something which is really important to us, and that is that actually Indigenous children don't just matter to us. They don't just matter because actually we want to see them healthy and thriving and happy, but actually it really, really matters to the whole of Australian society and the whole of New Zealand society. They're going to be hugely important for that population as they age. You can't afford to have ones who are not well educated, who don't know who they are and have a strong sense of identity in their culture and their place in this society, and who are not healthy. We simply can't afford it. So I come back to this. Again, I'm really making the case for why doing something different, and I hope you're still awake. I can't hear any snoring yet, so that's a good sign. But this is something which says, again, a graph which speaks a lot if you can look at it, and I'm going to just say 2 really simple things about this. This is looking only at Māori families and 25 years of census data. And what it tells me is that Māori families do have slightly higher numbers of single-parent families, and they also have multi-family households. There's a whole host of reasons which I won't go into about why that is the case. And I was very struck because I looked at your statistics, some of which the Children's Commissioner talked about yesterday, and I was very struck at the similarity in your experience as Aboriginal and Torres Strait Islander. You also have very high numbers or percentages of sole parent households, particularly those led by women, and you also have larger numbers of multifamily households. So this is a pattern that's actually common amongst Indigenous communities. And there are very real implications for that. In New Zealand, for example, we've had a whole series of neoliberal policies implemented from really the mid-80s, pursued during the 90s, and even up until the mid-2000s, until the present, which has seen a real attempt to get tough on single parents and to punish them for their immorality, quite apart from anything else, by basically removing or reducing benefits and a whole host of putting in much tougher other policies and, if you like, requirements for them to meet, such as naming the father. Now, I don't know the specifics of what's happening in Australia, because I do acknowledge that actually Australia has done some things. For example, you've paid things like the baby bonus, which we haven't paid in New Zealand, to help people who are actually having babies. And I think you also, like us, have a tax credit system that allows some benefits for families who have dependent children. But actually the context of these sole parent family households is one really of punishment. It's one of blame. It's one of actually diminishing resources. And there is actually another slide that I could have put in that shows that in effect what's been happening over the last 15 years or so in New Zealand is the effect of that has been to actually increase and continue to drive up the rate of child poverty, because those are households with dependent children in them, and they are disproportionately Māori households. So what happens in terms of government's approach to policies makes a very real and sometimes immediate effect on those households. And all of the good effort and work that you do cannot fix a fundamental problem of a lack of income, for example, or lack of access to good quality housing, or a lack of access to good quality early childcare, if that is not actually being provided and supported. So, here's a very interesting, another model. I seem to have been consumed with models, I'm sorry about this, but this is actually, I think, one of the most powerful ones that I've seen. It's by Van Dijk and Cushion. And it's around the multiple determinants of health, but actually you could read into that the multiple determinants of well-being. And it says something really interesting, because what it really says is that in terms of death and illness or sickness, mortality and morbidity, the things that make the biggest difference is not actually the quality of clinical care, although that is hugely important and in many ways is the thing that we can easiest control in some arenas, but it's actually the social and economic factors. It's actually the health behaviours, and in some cases it's also the physical environment. It's the combination of these together that makes the difference. And what that says is that actually we have to go beyond just looking at the quality of services we provide and the obligation. Remember, I started by saying the obligation for integrated services, particularly those that are Aboriginal and Torres Strait Islander led and governed, is actually to step up a notch and to recognise that actually those services do need to be high quality, but they exist within a context. The context is actually about what is going on in terms of socioeconomic determinants. It's about whether or not families are receiving adequate income, whether or not there is actually a positive reinforcement of identity, particularly cultural identity, and the ability to express that, whether or not you have access to decent quality housing and good education. These have, if you like, the much bigger effect on outcomes for our children and young people. And bear in mind the mystery framework, which was around life course. We need to get it right from the beginning if we're going to have the better outcomes for everyone. So, this is really the rationale that we're using to say, it's clear, I could put up heaps and heaps of stats and graphs, which we don't need to, which show, in terms of education, in terms of justice, in terms of health, in terms of housing, ownership, etc., that actually we're falling behind and there remains a massive gap, and in some cases that gap is actually getting wider between Māori as Indigenous and non-Indigenous communities within our country. There is a need to do things differently. We can't keep doing what we've been doing. It is not acceptable to do it. There is a need to do it differently. And what's more, we have to actually be honest and own up to the impacts of poverty and address the social determinants within this. So that's really what this model is saying to us. And that's really the case that I've been trying to make. So I'm conscious that I have to sing for you at some stage. So I'm going to move on and talk about, well, what is the model, actually? What is it? Well, there's a lot of talk about whānau ora, for example, and this is our waka, our ship. And bear in mind that Māori sailed across the largest ocean in the world, and Polynesians. We ended up at Rapa Nui and Hawaii and around at Marquis and the societies, right across the Pacific and down into Aotearoa, New Zealand. So the waka is a very powerful symbol for us. But this is really about joining up all of these activities, including economic development, our work and our income, our education being a crucial pathway to actually improving the lot of children and young people, and nowhere more crucial than actually early childhood. Again, quality early childhood education, strong cultural identity, strong reinforcement of who those kids are, the fact that they belong to a community, they belong to a family, they belong to a heritage, and they have a place in this society. Justice and corrections. I could talk about each of these areas in some depth, but won't. But they're all hugely important: housing, health, and social services, which most of you work in. How do we do that? How do we actually join these things up? Because there's no doubt that people have talked about it for a long time. Governments have promised much for a long time. And there is now, of course, a huge amount of literature. There's a very good site, for example, if you're interested in following up on some of the literature, on the King's Fund from the UK. If you're looking at, for example, it's under the title Marginalised Communities and Integrated Services. But most importantly, this is about using our experience as Indigenous communities and saying that actually it makes sense. We know that our children and ourselves don't experience isolated silo activities. When we go to school, we're not just students. We're actually the people that we are. When we go to visit a doctor, we're not just a patient. We're actually the whole person that we are. And when we go to get a job, actually we don't just leave who we are at the door. We're that whole person, and we're taking all of it with us, no matter where we are. So we know that this makes sense. Whānau ora really is a concept that puts family decision-making at its heart. It's the nucleus really around what transformation needs to take place. And I know that not all families function as they should. I've acknowledged that before. And that in some families are actually a risk to their children, especially when the adults or the elders within them actually perpetrate the violence and disrespect to the children who exist within there, which is why we have to keep mindful of the inherent dignity and respect that children deserve. They are the foundation actually about the continuation of our culture and our future. They are the manifestation of our values, and they are our hopes and our expectations actually about our world tomorrow. We know all that. We have to live and breathe that every day. Whānau ora means, it literally translates as family wellbeing or family health. Whānau ora means a whole heap of different things to different people. And it's been unfortunately used as a kind of panacea, as something that's, an inherent truth that will solve all our problems, and we know that that's not true. We know that there's a whole heap of complications that sit in there, not the least of actually getting organisations, NGOs and professional organisations to actually talk together, to share a common language and common goals. But also, and I want to acknowledge, there are very real inherent problems, for example, with tribal authorities competing with each other for control, competing with each other for access to resources. These are not just problems that exist or reside solely within the government sector, they also are inherent to within our own communities. We also know that there's a long-term program of capacity and capability development that's going to be required. Now, I'm using the National Hauora Coalition Whānau ora model because it's the most comprehensively systemic developed approach that I've come across, and also because I happen to chair the coalition, which is a Māori governed and led organisation and a national network using primary health care as a foundation for this. So what they've done is develop a system. Again, there's a whole set of complexities that sit behind it, identifying some priorities. One of the two key programs is one called Matua, Pepi and Tamariki, which is parent, baby and child. And it recognises and is built upon that very first approach, the recognition of life course, the fact that we need to, from the very earliest, from conception right through to birth, right through to early childhood, middle childhood and adolescence, do everything we can to get it right for our children if we're going to make a real difference. So we want to put most of our resources into that area. The other area is a real priority, I won't talk about that in the context of this conference, around chronic care. And that's working mainly with our elderly and actually trying to better manage their conditions. But those are the two priority areas. Now what this says, it looks very complicated, but really it says what you probably already know and what your organisations, particularly if your national networks are dealing with. And that is the attempt to try and get much better, if you like, systems in place to monitor what it is you do. But here is the real challenge here, and then I'm going to bring this towards an end. The real challenge is not to keep doing, as I said, what we've all been doing. Despite our best efforts and our best intentions, it's not going to get us there unless we fundamentally approach this differently. We have to actually be focused on the outcomes. What is it? What is the difference that we're really making to these children and young people? Let's be honest about what we actually are achieving with them and with their families. So in order to do that, we have to actually look at outcomes, not just outputs and not just inputs, because that's the way in which many community-led organisations have focused, and I have to say, the way in which most government agencies have focused. What are the outcomes that we actually achieve for these families? Do we have a robust system and a way of measuring these and reporting on these? Because we have to have that in place. Do we have an IT system that allows us to do this and to provide us with real-time information that we can use to adjust what we're doing? Do we have an electronic case management tool, for example? Now, I have to say that in our case, we've actually worked on each of these areas and have developed specific tools which we believe will work with Indigenous communities to do precisely this. We're not the only ones, I know, but we do have to have a level of sophistication, is what I'm trying to say to you, in order to step up the game. And importantly, do we have final order networks? Do we have networks of like-minded, skilled organisations with whom we collaborate to actually achieve these outcomes, particularly across sectors, who share our values and our goals? Because we need those to actually bring this together. And we need ways of funding mechanisms that actually provide some certainty. It is absolutely appalling that community organisations, particularly those that are Aboriginal and Torres Strait Island or Indigenous people-led, continue to have to grapple with very short funding cycles. There's a degree of certainty required to get this level of sophistication. We need longer funding cycles, 5 to 10 years minimum, in order to plan and to move forward. So all of these have a huge layers of complexity, specifics that identify the pathways based upon evidence of best practice, based upon our own experience, the use of our networks, our own values being reflected in this, but also some honest reporting about what it is that we're doing, and a real keeping a close eye on whether or not we're turning the corner on these. All of that is required. It is actually fundamentally, in many ways, a new model of care, I've titled it, but in many ways a return to an old way of doing things and a reconnection to those joined-up approaches that we had before. It is focused on outcomes. There's a lot of international literature, as I've said before. It's focused on joining up those sectors, housing, employment and education, and recognising that actually they make a huge difference to what happens for children and young people. It's focused on something that I know many of you understand only too well, the need for early intervention, the focus, for example, on primary and community-based settings, and the need to actually keep children in their home environments as much as possible and connect to their families as much as possible, as much as safe, rather than relying on institutional care and certainly relying on moving them well away from their communities. So a move from this idea about acute and interventions to primary prevention and community-based care. I know that we talk about this a lot, but we always end up being dragged down the other end of the spectrum. The best investment we can make time and time again, we see, in terms of good outcomes for children and in terms of cost saving, is to invest at the earliest possible stage. It's to invest in the primary and community care, and it is to invest in the communities that have the most at stake for these children. We need more effective management of these, and really that kind of public health approach is something that I'm promoting, that focus on prevention and joined-upness. There is a call in this speech, and as I said, it sounds really simple, but it's really radical, that actually Indigenous models of care are the basis for true joined-up services within our societies. And that only those services that are truly quality, and let's be honest about that among ourselves so that we get the best for our kids, will actually improve outcomes. We have to be prepared, as I say time and again, to step up to a new level. Health and education of these populations won't improve without a specific focus and a commitment to equitable outcomes for our children. We have to keep our eye on the longer term and bigger goal. And as I've said, these are the most cost-effective and most morally defensible, actually, approaches that we have, because it basically meets the needs of children and provides better long-term outcomes, better long-term experiences for them. And it requires the active engagement and indeed leadership of Māori and Indigenous populations for this to occur. So that is my message, and I hope that that is something that resonates with you. Really, there is a real opportunity to transform what we do. There is a level of sophistication required to do it. There are some specific tools which we're happy to talk with other Indigenous communities about, to share that. And I have to say there are some very real challenges in New Zealand. We've been waiting for whānau order funding to come through, and it ain't come through yet. There's little pockets of trials of things. But actually the level of commitment that's required from our government hasn't actually eventuated yet, but there are promises. Despite that, we need to get on and put in place as much as we can within all of our spheres of influence, because actually this is the only game in town. We can't keep operating within our individual silos as if somehow that's going to succeed. It won't. Even our best quality services will only work with our communities when we understand that there is a bigger policy and context, socioeconomic and cultural determinant context, that also needs to be affected. And organisations such as SNAICC, joined up networks that have that real heart and soul to get better outcomes, are essential in that approach of, for want of a better word, lobbying, to keep their eye on the ball around those areas. We need income, we need good quality education, particularly early childhood, primary and adolescent education, and we need good investment in primary and community-based health care. Those are all opportunities for us. And on that note, I thank you, and I again remind us that actually all of us, I know, come here with that passion and that commitment for our children and young people and to see a better life for them. And I know that you feel that, you work that, and I really hope that actually you manifest that in everything that you do and every day that you do it, and that you recognise that this is an opportunity, it's a moment in time that I think we can grasp. And I encourage you, I wish you all the very best, and if I can help, I certainly will. Kia ora koutou. E hara I te mea no nei te aroha no ngā Tupu na I tuku iho, I tuku iho. Kia ora.